This is the X-ray for a 4-year-old girl with a Perthes disease on the left hip. This is the very first X-ray, and you can only notice a little slight difference in between this highness and the other side. Since this is a girl with painful hip and painful knee on the same side and probably also limping, we have to rule out Perthes disease. So we add to this pelvis AP a pelvis with a frog leg position, which is here. In this position now you can see a black line subchondral, which represents a subchondral fracture, and that is pathognomonic of a Perthes disease in the very first stage. You can also see a slight difference again in the highness or the height of the epiphysis compared with the other side, as you see here. So since the X-ray for the girl was suggested of a Perthes disease, we decided just to observe, because at that age most of them could have a very good follow-up. This X-ray is 6 months later, and you can see that this has developed to a non-very good Perthes disease. You see really the height of this very down. The lateral column, it's really small if you compare with the other side. This is the lateral column, and this is probably a herring on a very bad scale. And that's why we were very worried, and we asked also the frog position that it's here, and you can see this is almost all the head of the femur very bad affected. This is really clear if you compare again with the other side, which has a normal height, round and very well centered in this frog position. This has a very wide space in the acetabulum to the femur. So when we see that kind of a Perthes disease that it's really bad in the follow-up, we have to add some special positions like this one. This is an internal rotation of the hip with abduction, and you can see that if you try to do so, the pelvis tilts. See the obliquity in the pelvis down and also up. Also, we can see here on the other X-ray, this is a position with the adduction, taking the head out of the acetabulum, that the pelvis loses that tilting, and it's quite normally aligned with the rest of the spine and the rest of the body. But here you can see that the Chanton line is also lost, and a big cyst here in this metaphyseal place. This is probably going to be a very bad Perthes disease, even started at 4 years of age.